Awesome. Okay. Well, the last folks are trickling in. We can get started. So I will give a very quick introduction to SisterSong and to this event. And then I will invite incredible Lauren Cornegay to give an intro into Endo Black, our co-sponsor. And then we'll go around the panel and invite everyone on our panel to share their name, affiliation, and how reproductive justice shows up in your life. Awesome. So my name is Dr. Noelle Elizabeth Spencer. I'm the research manager at SisterSong, and SisterSong is a reproductive justice organization based in Atlanta, Georgia. And we are having the Research in Action webinar series this year. It is a new thing and an exciting thing for us. It's an opportunity for folks around a ton of different topics. Of course, this month is Endometriosis Awareness Month, so this month has been all about endometriosis. We invite folks who have expertise and lived experience in a topic to come into conversation around research, advocacy, and activism to bridge the perceived gaps between those different ways of engaging with reproductive justice. So with that, I'm going to pass the mic over to Lauren to introduce Endo Black.
Thank you so much. Hello, everyone. Of course, my name is Lauren Cornegay. I'm the founder and executive director of Endo Black Incorporated. I'm very excited to be here, very excited to be partnering alongside SisterSong to really amplify awareness around endometriosis, especially in Endometriosis Awareness Month. And I'm so glad that we have these amazing women that will be sharing their lived experience and also just sharing some vulnerable moments with you all. So if you would just take a moment to be patient with them, listen to their stories and take it and resonate with it. I think it's going to be very, very helpful for everyone that is on the call. And thank you so much again, Noelle.
Awesome. Thank you, Lauren. Is it easier for folks if I don't, well, I'm just going to pick the person I'm looking at right now. And so I will give it to you, Kyla. And then if you can popcorn it to the next panelist, that would be wonderful. And again, it is name, affiliation, and how reproductive justice shows up in your life, lifestyle, work.
Awesome. Well, thank you, Noelle. My name is Kyla Thompson-Canzader. I am the creator and founder of pinkproverb.com. I'm also Healthy Kyla on YouTube. I talk about my endometriosis journey and my health journey and just my motherhood journey. And the last question was about how I connect this to my reproductive justice process in my own journey. And, that right now is just something that I'm continuously doing. So currently my goal is to start doing more health advocacy with hospitals. So that's my goal for 2026. And popcorn.
Awesome.
Of
Can you
course.
popcorn it?
Sorry. Yes. Julia. Good to see you, sis.
Good to see you too, Kyla. Hi, everyone. I'm Julia Mandeville. If I sound a little different, it's because I'm originally from Barbados. And there I co-founded the Barbados Association of Endometriosis and PCOS after getting my endo diagnosis in 2014, founded that organization in 2016, moved to the US in 2019, and then I pursued my PhD in public health. So I'm on the road to complete that next month. And in that process, I am centering endometriosis and other conditions that affect women and persons assigned female at birth, specifically those who identify as Black, African American, and are from the Black diaspora at large. And so I've taken basically my personal advocacy journey and integrated it into my research, I guess, activism, so to speak. And so it's not just academic, it really is how I live from home to here now. So really happy to be here. And I will popcorn it to April Christina.
Thank you, Julia, and thank you, Noelle and Lauren, for this opportunity. So excited to see my endo sisters. I haven't seen you guys in quite some time. So my name is April Christina. I'm known on social media as I'm April Christina. Roughly 12 years ago, I was diagnosed with stage 4 endometriosis. And during the pandemic, I was officially diagnosed with infertility. I have already underwent one cycle of IVF during the height of the pandemic that was unsuccessful. And now I am pursuing being a single mom by choice with sperm donor Invisalign, say that 10 times, with sperm donor now as a Black Christian woman in this space, as being a women's wellness advocate. So I am constantly still on this journey, especially finding African American sperm, which is a whole nother challenge on its own, that I did not expect would even be a thing, and just opening my mind and opportunity to other aspects of what motherhood looks like at this time, and just being an advocate for that, and just opening up other people's mind, especially as being an African American woman in this space now, as deciding to embark on this journey by choice as a single mom, and just letting people know that it is okay with being a mom and being a single mom by choice, and having all of the different other opportunities that you can have while still trying to expand into motherhood, into what that looks like within this community. So I'm definitely excited to getting started and talking about reproductive justice and what this looks like moving forward with this amazing panel. And I'm going to pass it over to my endo sis, Brittany.
Hi. Thank you, Noelle and Lauren, for having me a part of this panel. I'm super excited to be here and so excited to be around and hear the stories of all the other panelists as well. Um, yeah, so my name is Brittany Brown. I am the 2024 Olympic bronze medalist for pairs. I run the 200. I'm originally from Southern California. And I started my endo discovery journey, I would say. Probably back in college. I went to the University of Iowa, uh, and I was in pain pretty much my whole college time, as I was in college. I recently got the surgery for a laparoscopic surgery in 2025, in 2024, going into 2025, which has completely changed my life in a lot of good ways. And been talking about it publicly, my endo journey since 2023. So I think reproductive, to answer your question, reproductive justice shows up a lot in like the spaces that I'm in. Um, just a lot around athletes, a lot around Black athletes, and how autonomy and choice and choosing is like, we're not really able to always see that as an option, a choice is an option. So just in like sharing space, talking about my journey, last year I hosted an event for women who have endo or PCOS or any other health issues in LA. So just like curating spaces, I think is like really important. Um, and where I see my reproductive justice work going in, and just now venturing out into this space. It's been like a couple of year or two since I've been publicly talking about it. But it's been an interesting journey, and I'm really excited to be around so many and yeah, Endo Black sisters. Like it's just different. Like it's a different type of community. And like, when with Endo, like you're able to like um hear them and understand them on a different type of level. Just as immediately as you hear them say that they're experiencing this. So excited to be around you guys today and hear more of the conversation. So yeah, thank you.
Thank you so much for those wonderful introductions, and thank you for already being so candid in sharing your stories. There's such a power to that, and I just want to express so much gratitude for your willingness to share and your openness. And I also loved how you all took that question in different directions, and I'm excited to hear your different perspectives come out throughout the rest of the panel. Just as a bit of level setting for the folks in the room, this panel is scheduled to go until 7:30 p.m. Eastern, which means we'll have about 30 minutes at the end-ish for questions. If you do have questions that come up, please do put them in the Q&A box, and we will get to as many as we can. Please also feel free to chat amongst yourselves as well. We love to, see folks talk about different things they're hearing, if you want to give kudos to the speakers, whatever that looks like for you. But definitely please do put questions in the Q&A as we go so that we'll have them all ready by the time we get there. Awesome, thank you. So with that, I will go to our first question to the panel, and this is to anybody to start. I know some of you have shared a little bit about what you do in terms of work, advocacy around endo, But I'd love if you could share a little bit more about what that has looked like for you, like how it's shown up in your work, in your research. Just share with the audience what made you say yes to coming to speak about this today. And I can pick on someone if it's easier. Oh, April, go ahead.
So when I was initially diagnosed with endometriosis, it's definitely an unconventional way. So I work in healthcare full time. I've been there now for 20 years. And at the time, I was doing clinical bedside and debilitating pain. I was on my cycle. At the time, I was working on the orthopedic unit, and one of my patients was an OBGYN. So at this time, in my eyes, she was the homie. She's my patient, but I need help. We need help. So it was like day 4, day 5, and I was just like, look, I know you're here to heal, but this is what's going on, and this is what's happening with me. This is what I'm dealing with. And at the time, I didn't have the clinical signs and symptoms of endometriosis over a decade ago. So I was very nauseous. I had very, very bad leg pain, migraines, and I'm like, what's happening? And at the time, my parents and I were being proactive. We're going to doctors and making sure I don't have any blood clots or any pulmonary embolisms based on the symptoms that I was saying. But now here I am with an African American OBGYN as my patient. And she immediately was like, oh, it sounds like you have endometriosis. And I've never heard of that before, didn't know how to spell it, barely was pronouncing it correctly, had her write it down, just trying to decipher and understand what was happening, what was going on with my body. I immediately called my mom and I was like, this doctor, she's an OBGYN. This is what she's saying I have. By the time I got home, my mother had printed out like a stack of all these things that, we're going to read, we're going to look up. And that was like my first level of education of what endometriosis looked like. I mean, now today you see there's different studies, there's commercials, there's so many different pages and platforms on social media. When you talk about 12, 13 years ago, at the time, that just wasn't happening. So I had my first surgery that was an ablation. Again, I didn't know what was going on, but it was also an exploratory laparoscopy. And that was when I was officially diagnosed with stage 4 endometriosis. Then maybe like 10 months later, I started getting breakthrough bleeding all over again, as if like nothing ever happened. It was like history was repeating itself. It was a brand new episode. Again, now being pain free and thinking that I was endo free for like 10 months. And now it's presenting itself again. So that's when a light bulb hit and I was like, something else is happening, because if I'm dealing with breakthrough bleeding, my cycle's not supposed to come on. I'm having pain again. I'm getting nauseous. I'm getting leg pain, everything. Something else is just not right. So that's when it hit me that I need to start taking this a little bit more seriously. And it's not just a 30-minute procedure. So that's when my mom, again, now, stack went here. Now we here. We trying to figure out what's happening, what's going on. And then that's when we realized that they're specialists for endometriosis. A year prior to that, I didn't know that. So I went to the specialist and he's like, yeah, no, you have to get surgery again. Went and got surgery now a year and a half after my first surgery, not covered by insurance. That's a whole nother story all on its own with the endo specialist living in New York. And thankfully, he was able to excise. So I got an excision surgery, which is really the real surgery that you should be getting when you have endometriosis instead of an ablation. So I got an excision surgery. That surgery was over 7 hours long. It had went all the way to my bowels. I had no clue that the endometriosis had even spread. The lesions had even adhered to my bowels. I didn't know any of that because I'm still functioning normal. Like I don't have any symptoms, still urinating, still doing all the things like how I think a normal person is supposed to do. But inside, I have this disease that's really like taking over my body. It was at that moment that I was like, okay, who else is talking about this? Like now I have to go on YouTube. I have to go on Facebook. I need to find somebody that look like me. And in the beginning, like I was nervous and I was scared. So I was never showing my face. I was doing, the little, let me write a little character. Let me do a little picture with a smiley face and say endo sis, like we got this. We're strong, endo strong. Until I realized that representation mattered to me and me showing what I look like mattered. And if I wasn't hiding behind it because I was like happy that I was able to like use this as part of an outlet and as a part of therapy for me. But the more that I started talking about it, the more that I realized that, again, showing my face meant something. Representation was important to me. And then I started realizing that there were so many other people that looked like me that was in the community that was suffering in silence. So that just put a whole battery in my back just to keep going. I didn't even know where this was going to go. Any panel that anybody invited me on, even though I didn't look like nobody on that panel, I'm going to be there because I wanted people to be able to understand that when you're looking up endometriosis and when you're looking up your cycle, because I started mine when I was 9 years old, like these are things that as adolescents and as preteens that should be alarming to you when you're talking to your community. And when I say community, there aren't everyone that's on here that will feel comfortable enough to talk about it to the masses like how we do. However, you can talk about it to your friend, your niece, your cousin, someone else that you're having those type of conversations with when they're talking about like I'm having painful periods where you can be an advocate within your conglomerate within the space that you're actually in. So that was the initial like turning point for me after my second surgery to realize that presence and face holds more value than me just posting facts and stats. I wanted people to be able to identify with someone that is in their community that actually looks like me that is dealing with the disease. So now fast forward when I started dealing with infertility, it just was a no-brainer for me because I'm like, there's a whole pandemic happening out here. And it was so much uncertainty. It was like a few months after the world had shut down. And at that time, they didn't even deem IVF as being essential. So I was going through the entire cycle when IVF wasn't even essential. Nobody could come inside. If you tested positive, your entire cycle is done. And it doesn't matter at what point through your journey that you're on, if you test positive, that cycle is done. So that was a whole nother thing that I really wanted to educate people on and for people to just get information and data with having stage 4 endometriosis, with having a low ovarian reserve, like what does that look like? So I just really wanted to make sure that presence meant a lot to me within this space.
Absolutely. Thank you, April. Julia.
Hi. Thanks for sharing so much, April. Similarly to April, so with me, my journey started not as young as 9, but around 10, 11. And my very first cycle was extremely painful, crippling. And so that happened every month and no one knew what was happening. Until I got married and I was having additional pain, and so I went to my OBGYN and he was like, I think you may have this thing. And he like passed a pamphlet that had the word endometriosis on it. I was like, what is this? I've never seen this word before. And for me, it was a little aggravating because I come from the public health realm. I'm a public health professional. I loved studying, diseases and their origin, and I had never seen this before. And so when I started to do my own research, I was like, why am I not seeing anyone that looked like me in the stats? And I got really angry, really, really angry. And so I had the surgery. I was told I had severe endometriosis, which is stage 4 as well. And it was all over my balls. And I was then told I needed to get pregnant. I was like, well, that was not my journey at that point in time. To then find out that it's actually what a lot of people have been told to do after their endo diagnosis, even if they're not financially or mentally or emotionally ready for it. And I knew I wasn't ready, and I was like, that's not happening. And so I went on GnRH agonist, and it was great, no pain. But then I went through the premature menopause, and I was like, this is always. It seems as though it's always between a rock and a hard place with this condition. And so I got the opportunity, I'm going to fast forward, but I got the opportunity to come to the US and do my PhD. And this is after I founded BAEP because it was just very aggravating, as April was saying, to be looking for information about endometriosis and not seeing yourself represented. And so we started that representation and joined other entities in the Caribbean. And then we also found Endo Black and we started following them from their inception. And then when I moved and I realized, hey, we are actually in the same geographic area, I reached out to Lauren when I got the opportunity to do my PhD, and I said, hey, there's hardly any research on endometriosis in the Black population. I have this opportunity. I have these great mentors who also study endometriosis, and they are open to my idea of looking at how endometriosis affects Black women. And yes, I'm a Black woman, but I'm not a Black American. And so I thought it would have been disingenuous to just do the research myself and then claim it. That's why I reached out to Lauren to get Endo Black intimately involved in that research. And so we were able to publish a study on the relationship between stigma and racial stereotypes in women with endometriosis, which was very telling. And then we built on that within the lab I'm in at George Mason University to just continue doing research on endometriosis and looking at the impact of, racial identity and what that means in terms of outcomes. And so I'm continually trying to do that with all of the work I'm doing. Like, it really is very frustrating when you're hearing, oh, endometriosis is a white woman's disease, or endometriosis doesn't happen in people older, in people younger than like 20 and what. And I'm like, that's absolutely not true. And I think the more research that we can do to dispel those myths, the better for everyone involved. And so that's more so why I'm doing what I'm doing. I got very angry and I decided to put my skill set, which is research and public health, to the test and apply it to something I'm very, very passionate about, which is just improving health outcomes for Black women, Caribbean women, and, people that look like us. Because if we don't do it, who's going to do it for us? That's kind of how I'm thinking. So, yeah.
Amen to that. I can go next. And just to piggyback off of what everybody has said, I think most of us, and Brittany, welcome to the club, right? Like, I know this is year 2 for you. Most of us on the call, we know each other. We've been in this game for a long time. I want to say, I think we've all kind of been sharing for the last 7 to 10 years. And like that question is such a very complicated question to ask. Like, I'm hearing everybody's answers, and I feel like we say it every year with how our pain starts. But when I think about like my journey and where I am now and just like what I'm doing with my work, I always ask myself the question every year, like, how can I make a difference? And I think in the beginning, we all did it, intuitively, right? It just started with, hey, I have endo, like really just saying it out loud. And I think I was just really proud to say it out loud because for me, my journey was just painful cycles for 12 years before being diagnosed. It was seeing doctor after doctor after doctor and not getting a response. And my favorite thing to ask is why, right? So when I finally did get diagnosed, it was, why did it take so long? And then, is it just me? Am I the only Black girl? And I started asking those questions out loud. And all of a sudden it became a thing, right? Like, because the way I got diagnosed was through a specialist. Nobody told me to go to a specialist. It was just I got so tired of going to doctor after doctor after doctor. And my mom literally did the research and she was like, hey, like there's this center for women who have some type of complication. Go there. So I went to GBMC, the Endo Center. It actually is an Endo Center at here in Baltimore. So I went there, Mercy, not GBMC, but Mercy, and I met Dr. Hawkins there. And she was the one who diagnosed me. It was, before Dr. Hawkins is the Dr. Hawkins we know today. She was under another doctor, and she happened to walk into my room, and she said, I have endo, and you probably have it too. And that was how I was diagnosed. And unfortunately, it takes us to be in the room to say it. If anybody could leave with anything from my story or any of our stories, it's number one, you do not need a doctor to tell you to go to a specialist. If you have painful cycles, just go to a specialist. You don't need someone to say, you're cleared, something's wrong with you, go. And I think honestly, a lot of times that has been told to us, like we need to go to our OBGYN and we need to wait for them to tell us to go to a specialist. And that has delayed a lot of individuals on their journey. And I just pray that we can limit that number, right? Like we can figure that out. The other part is that I feel like now I'm struggling with or trying to debunk is the long-term effects of this game. Because a lot of us have waited so long to be diagnosed. Like, we haven't talked about the psychological part of this game. We haven't talked about, the whole body changes that we go through. And for me currently, what I'm currently dealing with is being diagnosed with anxiety all of a sudden, right? And I think that my body just got so tired of always being on edge. It was something's going to happen. Like, I'm always bracing because for years it has always been, you know what, girl, in 2 weeks it's about to go down. Like, it's like that has been the journey. So before I was able to become pain free, like, I've always braced myself. And then when I became pain free, I started finding myself bracing in other areas because my body was just so used to the trauma of bracing. So, I think that this is a lifestyle, and after 15 years, I realized it truly is a lifestyle that does not go away. The target just changes. It is, you have to start figuring out your pain. After you figure out your pain, you have to figure out your body. Then you have to figure out, how do I get to my goal? Do I want to become a mom? After you become a mom, how do I like stay sane as a mom, right? Like, just all the things that you have to think through. So now my work is really focused on, how do we educate people to understand that, yes, it's not a white woman's disorder, and we tackle that, right? We got a lot of hospitals to change that language. But now we have to change the rhetoric. We have to change the way people see us. We have to change the way people view us. Like, we are not, individuals who can just take pain. And that was something that was written in a lot of medical books, that Black women are stronger, so they should be able to take pain. But it's a holistic disorder, and now we need to tackle it that way. So that's my goal, to figure that out in some way, shape, or form.
Yeah, these answers are like, I'm just like, I feel like I'm just like observing so much and just like soaking up so much. I want to go back to Julia's point earlier about, I love that she used the word, she got angry. And I think sometimes, a lot of times, like, anger can be such a bad connotation for Black women. And I think anger also is a word that can be used to, like, it's an emotion that can be used to like signal like something's wrong and that we should act. And I think obviously there's pros and cons, there's negatives and positives in how you act on the anger, but anger is a good emotion to like say anger, frustration, like fed up, like it's like, okay, like I have to do something about this. And that's kind of like um where it got for me, like it was just like it got to a point where I was just like, I'm just keep dealing with this stuff. And I think we talk a lot about how like women, we're just taught, especially Black women, taught to deal and tolerate with so much. And with I use my body as my job. So it was very conflicting for me because with my job and what I do, like be tough, be strong, push through, do all that jazz. And I was like, it's getting to a point where I really can't push through. Like, this pain is like really debilitating to me. And not even just the pain, it was like the nausea, even the bracing, as you talked about, like, I'm already so tense and like, I'm trying to be limber and flexible, but I'm bracing for my period every month. I'm bracing for the pain, the anguish, and I'm bracing for all the emotions that come with it, the nausea, the headaches. Every month I'm bracing for it. And I'm like, I just don't think I could keep, living like this. Like, I feel like there has to be something that, like, like my body is the only thing that I have that I live in this body every day. And I have to move and around with it and I have to interact with this body with other people. It's like I can't really interact with other people and be like a whole, full human being if I'm in pain. Um, so that's what really like kind of pushed me to like get the surgery and really just take the signs and the symptoms my body was telling me into consideration. And I think we are so considerate of others, especially women, especially Black women, that we forget to be considerate of ourselves. We forget to listen to our body and what our body's saying to us and what our body's like trying to tell us. There's been plenty of times my sister would tell me, maybe my sister are really close, she'd be like, Brittany, like, you are not well. Like, I know you're trying to be like this athlete, everything's fine, but like, you're not good. Like, and I had to really sit back, like, oh yeah, like I guess you shouldn't be in pain like this. I guess, and I think so often we normalize the pain. And then doubly for me, because as an athlete, like pain is a part of like what kind of pushes you. Like when you're in the weight room, you're lifting, like you may feel some discomfort. But it doesn't mean it's the end of the world. But it's like also learning like what is my discomfort? What is like a level that is too high and what's level that's like medium and what's level that is sedentary. So it's like having those levels have really been helpful pre-surgery and post-surgery. Like I think someone talked about before, just like the full body like that it takes and the psychological effects. Like I definitely like after my surgery, like I remember like going online, I'm asking women like, like I'm like really emotional post-op. Like I'm really like, and I didn't like I never had babies, and I'm like, people talk about postpartum, but like the recovery after the surgery, I was very emotional for a lot of reasons. Angry at some of the doctors that like dismissed me, a little angry at myself for not like, taking the time to like actually do it and do it in a timely manner. A lot of forgiving. I do a lot of forgiving for myself and grace and patience for myself. But like sad that I was like realizing like I was in pain for a long time. Um, and this will be a lifelong thing. And this surgery has helped, but like all the other things that come after surgery, the comorbidities of endo, there's a lot of stuff that I'm also now finding out like, oh, I have this, or I'm exploring what this may be and what other health challenges I may have, and like learning that it's a full body, full body, like it affects everything, not just the uterus. It goes everywhere, it affects the mental, the emotional, all these other diseases that come with it. Um, so yeah, I just like the pre-surgery, post-surgery, like looking online, trying to find women who look like me and um also trying to find athletes that was also like a different like perspective like that I was like in it was like more so like there was a couple athletes that I knew that got the surgery but they hadn't really been very vocal about their so I was like I don't really how do I return there's no and then even with my surgeon and my pelvic floor therapist we talked about there's no protocol like for return to active life after the surgery. There's no research to like actually figure out like, for anyone. There's a lot of women that reach out to me like post surgery, like, I'm just a runner. How did you get back into running? I'm like, I'm a professional athlete and I'm trying to figure out how to get back to it too. And I'm like, it was me, my PT, my pelvic floor therapist, and we were just trying to figure it out. Like, we were clear to do certain stuff, but then also realizing like where the endo was growing, like those muscles having to rework and rewire or calm down, and like the emotional side as well, the breathing after surgery. Like I didn't know it was that extensive. So I think there have been a lot of like why I wanted to be part of this panel. Like I think there's been a lot of very like small in like significant moments of women in the room that have like really kind of like really pushed me and really said like I think you should really like do something about this. I think you should really like the first person that told me was a fertility specialist because she my what's it my AMH levels were really low and are really low and I was like confused. I'm like how are my AMH levels really low and then we did the ultrasound and whatnot and she clearly identified what that looked like and endometrioma on my ovary and it was that conversation. It was a conversation I remember back in Iowa when I was in school. This other lady, like, hey, I think you should look into this. Um, and so, like, I think about those women. I think about those conversations, and they're very small, and they weren't like big and audacious. They were just like, I think you should look into this. So it's like, I always feel like I want to be that woman to be like, hey, girl sit down for a second. I think there's something going on. Like, I'm not trying to be all in your business, and you may never hear from me again, and you may not like what I have to say, but hey, let me just share about like whatever and even when it's other athletes as well, like even with nothing to do with endo, like injuries or whatnot, like or just other pelvic pain, like, hey girl, like you can go see a pelvic floor therapist. I know you never heard of a pelvic floor therapist, but these are other options for care when it comes to endo and help treating symptoms of endo. So I always think about those women. I want to I aspire to be that in all the spaces when it comes to this and like just any space that I'm in, like trying to be that gap filler and that little like silent like pusher.
Amazing. Thank you all for sharing your stories, your experiences. It was really interesting to hear the similarities and differences in your stories. I mean, some of the through lines I was hearing was around the importance of self-advocacy, the importance of, really making space for other folks in your lives to either be able to say what they think is happening with you or to be able to use your own expertise and lived experience to advocate for others. And also a little bit about the importance of having advocacy within the healthcare system too, especially in your story, April. So thank you all for sharing about how, this is showing up in your work and in your lives, because Endo is a part of your lives. And you have all managed to incorporate that truth in very different and also very impactful ways. I am seeing that we're getting a lot of really great questions in the Q&A. So I'm going to do a couple more prepared questions and then switch to the Q&A because we have a couple coming in that are really great. I would love for you to say a little more about, one of the focuses of this research and action series to think about how panelists have engaged with community. And I know each of you have talked about it a little bit, but I know several of you are also very prolific on social media and have really deeply engaged in community in person and virtually. So I would be curious if you could share a little more about how, in context of your work, in the context of your work around Endo, you have engaged with community, whatever that has meant for you.
I can start. So, I'm trying to think back, and it's so interesting because Kyla, to be honest, we've been in this fight for so long. I don't forgot we was in the pandemic talking about these hospitals like you gotta remove you gotta remove this verbiage. Um, so let me go back. I think my very first advocacy work outside of social media was me going into the schools. So I was going to elementary and junior high schools. I'm born and raised from Queens, New York. So I was going into these areas of like Southside Jamaica, St. Albans, Hollis, all of these key areas where there are African American, Hispanic, Indian, Asian, like that population, Jackson Heights. I went to Jackson Heights quite often, just in those areas, just talking to the kids because, they have like health education classes and stuff. And so like first and second period, I would go there and I would, ask them like, raise of hands, how many people are actually on their menstrual cycle? And you'd be surprised how many individuals actually do start their cycle. And, I was able to identify and say, hey, I started mine when I was 9 years old. I was in the third grade, just like you guys. You guys are in fifth grade, sixth grade already, I'm a vet here with my little pouch, getting bathroom passes and stuff like that. And I think that really was very fulfilling for me first to be able to captivate the young girls and then even afterwards to be able to talk to them. And, they asked me, well, how do I talk to my mom and dad? Because, I do have painful periods. So that was like the first scope of me dealing with advocacy outside of social media. Then after that, from consistently talking about it on social media, being a part of different panels, whether it's in New York or even when I seen that there were panels, I would take it upon myself to take the initiative to email and say, hey, are you looking for speakers? This is, my elevator pitch, young African American woman that's diagnosed with stage 4 endometriosis that had 2 surgeries a year and a half from each other. Can I share my story? And just being that light until it has developed into what it is now. So I was the one that was just like taking the initiative to do the panels before I was being asked to do panels. Now it's just a little bit more different. Being in the endo space, a lot of things are a bit more polished. So this is why I love being amongst my peers in these type of panels because you can gravitate and like glean from everyone. Now being on panels with physicians is, a little bit different because you're now speaking, because back then, to piggyback off of what Kyla said, it's like, just listen to me. I absolutely have endo. Like this is what it is. But now it's okay, what actionable steps are we going to take to make the changes? And for me, where I am now, I still do social media, but I'm more so leaning more towards the legislative side. The main thing that counts for me and what triggered me now, a decade later, wanting to branch over to that and being in those type of spaces on those type of panels is having stage 4 endometriosis, being diagnosed with infertility because now you have a low AMH and these ICD-10 codes, it's still the same. What are we doing? And so that's really something that, is something that is on my heart because I know what I had to go through to get insurance to approve my second surgery. And it was not easy. And if I didn't have someone to teach me what that was, I wouldn't be able to now educate other people on the different things that we don't know about health insurances to be able to get those surgeries because a lot of these surgeries, most of these surgeries, let me say that, sorry, are not covered by insurance. So when I'm on panels, I'm very now selective on the type of panels that I am on because I wanted to make sure that it's focused towards helping others and not just specifically saying I'm diagnosed with endometriosis. Now it's I have endometriosis and what are the actionable steps that now I can take for long-term quality health, for long-term quality of life and what that looks like. Because again, emotionally, getting a diagnosis and talking about it is one thing. But then when you leave there, you're like, great, I have all of this information. What's next? What do I do? And it's very subjective because we've all discussed our journeys and paths. And even though we have similarities of being endo sisters within this community, is vastly different. So how do we help bring that in together from a health standpoint to be able to help the masses? So that's really what I'm geared towards now as it relates to it and how to manage infertility and endometriosis at the same time. What are some of the questions that now you can ask your physician? So I kind of like gear myself towards those type of panels to have like that education so that again, as a patient, you can now advocate at a level of physician to patient. So that's really where now I'm gearing towards. But in the early days, I was like, yes, you want, yes, I'm gonna do it. Yes, like because it representation again, like I said before, it mattered so much, and I wanted people to not be ashamed, not be bad, not be embarrassed, not have different insecurities with being diagnosed with this because just like endometriosis and infertility, it is a medical disease. And sometimes we hide behind that from shame that we fail to realize what's really happening here medically. So that's really the journey that I was on before and where I am now as it relates to being on a panel.
Awesome. Thank you for sharing that again, April, because I'm literally going to build on what you've said. In terms of working in community, when I got my diagnosis, I was a teacher. I was a science teacher. I had a syllabus to teach. And then I got my diagnosis and I had to teach about the menstrual cycle and reproductive health. And I was like, well, there's no endo in here. So I'm gonna take the opportunity now and teach my kids about it, and other conditions. So that was my first, like, I'm gonna sneak this in here because these people gotta know type of situation. But obviously then with BAEP, we reached out to, and I'm speaking from the Barbadian perspective, reached out to a very small country. If you've never been, it's where Rihanna's from. Reached out to the Ministry of Education, the Ministry of Health, and you're like, we want to educate everyone about these conditions. Is there a space for us to do that? And they were so willing to work with us, the schools across the island. And it was easy to do that because, again, very small island. But after a while, we got tired because we are going helter-skelter and yawn across a small country, but it's still a lot on our bodies. And I was like, this is stupid. Not stupid that we were doing the work, but we were not practicing what we were preaching about being gentle with yourselves and giving yourself grace and, not overextending your body. So then we partnered with UNFPA Caribbean to write a textbook about Caribbean women and girls dealing with endometriosis, dealing with adenomyosis, uterine fibroids, the whole gamut, just dysmenorrhea. And we were able to donate that across the island to have it in the school library so that the students, when they were dealing with pain and they were going to either the sick bay or the guidance counselor, they had a resource to look into because we didn't have that and we thought at that age they needed to have that. And so that has been working. But then in terms of working with community in the more adult spaces, we recognize that a lot of other countries across the globe were developing strategic action plans and policies, and we were like, why don't we do that here? And so that was what we recently did last year. We worked with the Commonwealth Foundation, and we were able to bring in members from all of the different communities in Barbados. So we brought in persons from the church, from the Muslim community, from the disabled community, from the LGBTQIA plus community, because Barbados is predominantly Black, but we have such a melting pot of people that have other identities. And it was really important for us to ensure that as many voices were integrated into the strategic action plan for endometriosis as possible. And that was central to the work. And so right now we are working with the Ministry of Health and trying to actively implement it because if you know me, you know I'm not a person that is just about talk. I'm very action, solution, and result oriented. And I will hound you to get the work done. And so right now we have we have it established, but it's just to get it implemented because the goal is to have policy change and legislative change to improve outcomes for persons in Barbados and perhaps the wider Caribbean because it is the first one that has been done in the Caribbean. But it also requires us to reduce something that April was talking about, the shame and the fear, the stigma that is associated with these conditions, that's associated with menstruation, that's associated with women's pain. And so once we are able, I'm feeling really hopeful that we are able to address that as much as possible with this work, and see really good outcomes in terms of improved community education and improved outcomes for people with endometriosis and just people dealing with their reproductive health in silence so that they feel less alone. Because I think Audre said something about healing in community, and I don't want to misrepresent her, but I think it's really important, or was it Bell Hooks? One of the two of them. But I think it's really important that we recognize that it is critical to us. We are communal people, that we work together and support each other. And that's what the work that we have been doing at BAEP kind of hinges on.
Yes, and I can build on that, but Noelle, I just want to make sure I have your question correct because I will veer off to a couple of different places. So are we talking about anchoring the question? We're talking about how we started in the community, right? Our work in the community. Was that the angle?
Yes, how you've engaged with community. So
Yeah.
wherever that takes you is
Okay.
totally valid.
Okay, perfect. So just to build off of what the ladies have already shared. So for me, I have a background in education. I've been in education for over 14 years and back in education in a special way. So I was in the classroom when I was dealing with my menstrual cycles and endo pain. And I think my first form of advocacy was my girls. And I think it was, I remember the first time a teacher came to me, complaining about a girl who kept complaining about her cycle. And it drove me up a wall because he was like, I mean, she always asking to leave my classroom early, or she always complaining about her cycle. And I'm like, no, she has a problem and you need to give her her time. And it was just like, I realized then that there was just such a gap of understanding around girls and their cycle. And then that took me down a rabbit hole of just like how we are as African American women, because of what our ancestors went through, we've never really shared about our cycle genuinely. Like we've never had, that conversation about what is it supposed to be like, or, like what's healthy and what's not healthy, and just having real healthy conversations around our menstrual. And if you have endo or painful cycles, chances are the women in your family probably had painful cycles. So the message will always be traumatic. It's girl, go get your medicine and deal with your pain. And I think that that was the story for a lot of us that we just had to bear through. So for me, it started with me just making sure that I had menstrual pads in my room, right? And having conversations. Like I was a teacher that all the girls came to, even if they weren't even in my class, they came to my classroom because they knew that either I was going to give them a snack, I was going to give them a corner, or I was going to give them a pad. And it just kind of like, blossomed from there. Then I remember my first year, it was just all about me wearing a yellow button. I just got obsessed with yellow. Like it was, so simple, but it became a thing, right? Like to the point where it was like people would ask me what was endo. And before I could even understand the definition of endo, I was preaching about endo. It was, hey, let me tell you what's really going on. And you would be surprised how many women, especially with Black women, who will say, dang, I didn't know that was a thing. Like, oh, you mean to tell me my painful cycle isn't normal? And it's not. And unfortunately, I can count more on my hands the women who can say they had painful cycles and the ones who have never had a painful cycle. And to me, shows that there's a lot of women who are walking around undiagnosed, who are dealing with extreme pain, who probably are going to have long-term effects that they think is normal because everybody in their family went through it, and it's not normal. So that's how it started. And same with April, I thought like, okay, I'm just gonna sing it from the rooftops. Started with social, right? My background has always been communication. So I've always had my blog, and my blog ended up turning into a health blog. It just evolved, right? It turned into a place where anytime I learned something new, I shared. So, and to Julia's point, community is so important, and it's a part of just like our psychology as people. um, our baseline is always health, shelter, safety. But after you get that part, community is the only way that you grow and thrive. So I became like really thirsty for community. Like I felt like I was the guy in the club that was going to holler at every girl. Like if I saw a Black girl at any event, she was my new best friend. Like it was just, that's just what it was. So, and I became thirsty for it because I remember the first time I went to a march. This is before the pandemic when we actually had marches. And I didn't know that vitamins could actually help my pain until a Black woman told me that she was taking zinc and magnesium, and it was everything. It was never written anywhere. No doctor ever said it. It was her who like made me go down this whole rabbit hole of like, how do I find the right vitamins? Like, do I need to get my blood work done? Like, can I do it myself? What kind of vitamins? Like, and then that made me want to talk about it. And again, this is nowhere to be found unless you're going to the NIH website and you type in endometriosis and vitamins, right? Like no doctor is talking about it. It's not a part of any protocol. Then I went down a rabbit hole about herbs, and that opened up a whole nother can of worms for me. And then I became such a more spiritual person. Like now I'm sitting on a pot and I'm doing yoni steams every month. Like it's just like, like this journey is so full of pain. However, if you really focus on building your community and just finding the girls, like, or the guys, or, whoever in the journey, I promise you, like, you will find your way to getting everything you want out of this life, be it becoming pain free, figuring out your fertility. And I just deplore for everybody, especially the young girls on the call, like, do it now, right? Like I don't care if you've been diagnosed or not. If you think you have endo, just start building your tribe. Like start figuring out how to connect with the right people. I mean, do it as if you're trying to pledge. I want you to like stalk people, like ask people questions until you get the results that you need. What doctor did you go to? Like what insurances did you use? Like even now, learning that if you have your HSA card, like you can go to a naturalist and spend your HSA card. Like nobody ever told me that, right? Like you just need that person to like write that little piece of paper and it pays for itself. Like, so you are never pigeonholed in this journey, but the only way that you're able to find the answers is us literally connecting the dots. And we all have to be advocates in some way. So when you learn something, share something, be it like to the girl next door or, on your platform or at work. Like, I can't tell you how much I enjoy going to work and talking to the girls about either their hormones or like, what did they try? Like, what IV hydration did you use? And this is like with my endo girls and the girls who don't have endo, because the truth is, us as Black women, we are never going to get all the answers we want out of the doctors right now because the research does not point to us being a priority right now. Now, is it changing? Yes. Julia's changing it. Lauren's changing it. Like, people are doing this, but there's a place for all of us to make a difference. And the only way the next generation is going to thrive is if we take that little bit and run with it. Like, nobody has to be perfect. This community is not about perfection. It is about, like, let's figure out how to get to a better place. And I just pray that people stand on our backs and just become better. Like I would love for us to soon have the health conversations about just like how to proactively, before your child even starts their cycle, like get them ready for their cycle properly. Like, that should be where we get to, because we just have a lot of traumatic past with the health system that, our parents and our mothers struggle to get through, and we're still struggling to get through. So it's we don't have the energy to do it all by ourselves. Like, everybody plays a part in this. So yeah, I'm gonna get off my high horse, but I just feel like hopefully the thing that people take away is the only way for this to work is us all to advocate in some way, shape, or form.
Yeah, love the answer, Kyla. Like, I love like the importance of like community and how like getting through this is with like community and like um to go back to Noelle's question, like how do I interact with my community? Like um I um I think it's like innately in us, especially like Black women, to like, advocate and to like protest and to bring awareness, like, and to be like the backbones a lot of it. I was reading this book called The Three Mothers by Anna Malika Tubb. It's about the mothers of Martin Luther King, Malcolm X, and James Baldwin, and just like saying how they were so pivotal in their lives for the movement, and how these women were really shaping their minds, and how these women were really innately, like, really just building them. And I think about like us, like it's just so innately in us to want to like share and help. Like and a lot of the time then like my sport, it's like, oh well, I don't want to share this about this or that. It's just innately in us to like I want to help. Like, you think about the civil rights movement, you think about slavery, like it was so innately in us to protect, to help, to make a way out of no way, for not just me, but for others. Um, I think for me, like it's been like since 2023, since I've been openly talking about it. And it's like for me, it's been like in like the very small areas, like a lot of women will DM me and like reach out and just say, hey, I'm an athlete. I have this. Did you get the surgery? How was the surgery? How was the post-op? How was the pre-op? How was this? Um, so it's been very like interesting because like I didn't think a lot of athletes would have this, and like obviously because we just pain is a very different concept for us, especially athletes. Then add the fact they're a Black woman adds on two other layers. So it's been interesting in that way. Um so with that, like it's been a lot of sharing my story, sharing like how I was able to like navigate the process of finding out like, what was going on, who I need to talk to, who the right specialist I need to meet with. And for me, it's also like when I do talk to these women, I'm always like sending them like follow this website, follow this girl, follow this person. Like, I may not know everything, but like these are like I'm pushing a lot of resources to them. And I think that's also like another big thing I've been realizing that's like really powerful is like I don't know everything and I won't know everything. So it's like who can I send you to? Who can you heard my story? Here's a research of like how insurance works for this surgery. Here's a resource of like if you want to get involved in legislation, here's that. But like I can't do everything. So it's like also like being okay with I can't do everything as well. It's like I can't be in all the space. I can't be like Julie. I can't like be like April or Kyla. Like I have to be in my space and I can like, really well in this space and really like cultivate out this space and also like provide other resources when I can and when it's opportune. So it's been interesting, like being in this community and then like also like finding community as well. Because like I think we talked about that earlier. It's just like it's been really special, like finding women that have gone through stuff like me. And really and felt very enveloping because I feel like after my surgery, I was feeling so like I just don't feel good. And I'm like, my surgeon, like they tell people like, oh, like, after a month you'll be fine and everything's great. And then I talk to someone else and they're like, no, it takes about a year to feel normal. Like probably about normal. I'm like, a year, like, I'm trying to go back into my season. So it was interesting, like, and I was DMing like just as much as like I was giving out information, someone was giving it back to me, like, hey girl, you have to go to pelvic therapy. You have to go. Like it's not a if and or but. Like you just as much as you go to practice, you have to go to pelvic floor therapy after the surgery. Like that's the only way you're gonna start feeling a little bit normal and bring some normalcy back into your life. It was a major surgery. I think that sometimes like with the surgery, laparoscopic surgery, I think sometimes like when people call it minimally invasive, like definitely played with my head. I was like, what do you mean minimally invasive? Like, and I would like realize, like, oh, because the incisions are small. That's why it's considered minute. And then I was like, oh, but they're still moving stuff around, like, cutting stuff out. And like that's majorly invasive. So, like it was like a really like sometimes I wish they would change the name because they would just really help like to understand like the recovery process. It's not, yeah, the incisions are small. Thankful for that and awesome, love that. But like it's still majorly invasive. So, but I had to have another woman tell me that. And I could also share it with another athlete who reached out to me like, hey, like I just want you to know if you do plan to get the surgery, they do name it that, but it will be majorly invasive. Like it's going to be invasive. It's not going to be small, depending on what they find for you. But for most women, if they're looking for something they already may see on a scan, it's going to be pretty big. So, the community has poured into me just as much I poured into them, and I feel like it's been really, the reciprocity has been really nice. I think a lot of times you don't get the reciprocity in some types of relationships, but the reciprocity has been really nice to feel, and yeah.
Amazing. Thank you all for engaging with that question about community. I loved how, community meant a different thing to each of you, and that was really wonderful and helpful to share. And I don't know if you've been looking at the chat, but it has also resonated with a lot of folks who are in attendance as well. I do want to make sure that we have time to answer some of these questions. I will also invite all the panelists too, if you want to have a quick look through the questions, see if there are any that you want to answer like by typing it out, please feel free to do that. I know, Kyla, you're already doing that, but I do want to just close out this part of the session with a final question that was prepared. In 1 to 2 sentences, what would you say are your hopes for the future around endometriosis care? Not a broad question at all, I know.
I could go first. I think my hope is that it becomes a holistic form of care, right? Like my hope is that it becomes interconnected with all parts of our care, be it your specialist talks to your primary talks to your dentist talks to your mental health. Like it all is interconnected and everyone is thinking about it, because it doesn't become connected tissue until you make it connected tissue right now. So that is my hope.
Thank you, Kyla.
I would say for me, like I would like the diagnosis time to the treatment time for like surgery to be cut a lot shorter. I think a lot of women are in pain for a lot of time and for multiple years. And I think when you start like having your body in pain, I know Kyla talked about this earlier, it's just like your body's just so like there's like a mental emotional side that goes along with the pain. So yeah, I think that could be cut down short a lot and it could like save a lot of our the mental sanity that also comes with it because it really plays on the mental emotional side as well. So like from diagnosis to treatment, like I think that should be really I would really love that if it could be cut down.
A cure, ideally. That's my hope. But until then, I think just having everything destigmatized would make what Brittany mentioned a lot easier, like that diagnosis to treatment time, because then people wouldn't be questioning whether or not, this is what they have. The doctors wouldn't be doubting you when you're talking about your pain. So I think destigmatizing everything to do with endometriosis. So like what Kyla said, it's just a normal part of, your healthcare journey. Like the same way you know about asthma and diabetes, and you can walk in and get treatment for those conditions. I would like that for endo. Ideally a cure, but if not that, let's destigmatize it so that all of the barriers we've like mentioned are ultimately removed.
I agree with
Okay.
everything that everyone has said. Um, and understanding that it is a multidisciplinary disease. And I'm thankful for my excision specialist. When I went for my surgery, he was like, okay, just so you know, we have a cardiologist in here, we have an endocrinologist, the GI doctor's here. And I'm like, hold on, what are we doing here? Like, what? We just here for endometriosis. But you have to have somebody that's skilled to understand the multidisciplinary that takes place within your body. And like I said, mine spread to my bowel. So I did need that GI doctor to be there to help navigate. But even outside of that, like there's vitamins, there's herbs, like Kyla said, there's acupuncture, there's pelvic floor physical therapy. And when I started doing that, like that opened a whole different can of worms that I didn't even know existed with like the structure in my gait of how I walk. Also, just for the education, even if you are an OBGYN, a lot of people just think that it just stops there and just having the education of knowing that there is a specialist because you have to go to school to understand how to excise a disease like endometriosis and for OBGYNs to stop telling people that you just need to get a hysterectomy and you're going to be good because you're not. So I'll end there.
Awesome. Well, thank you all for engaging with that question. I'm going to switch over to the Q&A, and I will, just so attendees know, combo pack some of these because we have a lot, and I do want to make sure that we get out on time. So I see several questions in here asking about your journeys overall. So I'm going to combo pack two of them here that I see. Fiona was asking about if anyone on the panel has tried hormonal birth control to treat your symptoms. If so, what was your experience? And then I am going to combine that with the question that we got from an anonymous attendee, harkening back to what you were just talking about, April, with if you'd ever gotten the suggestion from a physician, specialist, et cetera, to get a hysterectomy. And if you could share a little more about that.
I'm going to combine, because I was reading, I'm going to combine a lot of questions and Endo sisters like piggyback off of me. I'm just talking about my experience. So I'll start backwards. Let's talk about hysterectomy. Let's talk about the diagnosis and understanding the definition of endometriosis, right? It's endometrial-like tissue that grows on the outside of areas that adhere to different areas. So we everybody's discussed what endo has done to them. I've discussed where it is to me. Let's just like really just try to like break this down like very quickly. You remove that organ, right? And we just said that is endometrial like tissue that grows on the outside, right? And it adheres to different places, pretty much like a sticker, right? So you remove that organ. Now, if you have diseases everywhere else, what you gonna do? You gonna remove all the rest of them organs? What's gonna happen? I have experienced so many different people within this community that has had a hysterectomy and has went back multiple times to get excision surgeries because we have to really understand, again, the definition of what endometriosis is. So you're removing that organ, but then you got a lesion on your bowel, you got a lesion on your lung, you got a lesion on your heart. What they gonna do? They gonna remove the heart? How your heart gonna be? What? And it's those type of conversations again with being in the community and understanding it, but we really have to break down what the disease really is to really understand. And that goes back to me talking about OBGYN, because now you look at these clinical diagnoses and you look at these clinical symptoms and then you look at the clinical treatment, and that is one of the things that you see. However, and again, everybody, people on this panel could piggyback off of it. You can get a hysterectomy, and we personally know people that have went back and has had excision surgery. So that's one part of it. To talk about insurance, my first ablation when I got my exploratory laparoscopy was covered by my insurance. We're not going to talk about providers. I'm just talking about standard care as it relates to just insurance in general. It was covered because the ICD-10 code was a D&C. And, when you have a miscarriage, when you have fibroids, when you have cysts, when they're removing standard ICD-10 code D&C. When you're getting laparoscopy and you're getting your surgery excised and they're going in, like we said, Brittany, minimally invasive surgery, and they're going into excise, that is a total different ball game. However, these doctors are not getting paid for the complexity of this disease, which means that there are so many other physicians, so many other things, God forbid, that can go wrong, which is why they're excising for hours. It's not covered. However, space, there is something called a gap exception. For my second surgery, I got a gap exception. Now, what that does is the doctor is saying to your insurance, hey, Mr. and Miss Insurance Company, this patient has XYZ stage 4 clinically shown. It did not work previously before. In my case, she just had surgery 10 months ago, got the ablation, have the definitive diagnosis, sent all the reports. We need to do this surgery within network prices. Everyone look up gap exception. People can write referrals, recommendations for you. I have done it for numerous people within the community so that it can work. And for a year, I paid in network prices for out of network expenses. So again, doesn't matter what insurance you have, Google it, look it up, gap exception. Talk about oral contraceptives. So my personal, what I went through, I did hormonal replacement as far as different type of oral contraceptives. For me, it was a Band-Aid. All it did was prolong my condition. All it did was prolong. Now, granted, did it happen for a little bit where I didn't have any pain? Sure. Was my cycle regulated? Absolutely. But after a while, I was just popping them like they was candy. And my body was like, ha ha, all right, what you got next? Then we would switch to another oral contraceptive. It worked for a little bit. Ha ha, what's next? What really helps is understanding, because it is subjective, understanding what the disease has done to your body. And again, finding out a real treatment plan that is going to work. And then also lastly, having physicians, whether it's holistic or not, or both, finding people that actually believe in what you have going on within your body, that has the time and patience to really work through the disease that you have going on with endometriosis.
I will piggyback off of that. She said a lot. I just want to leave a couple notes there because that is the truth. The hormonal therapies, it's all Band-Aids. The pain medicine, it is all Band-Aids. So a couple things. What are you going to do? In the words of April, you're going to stop, one, using plastics as much as possible, because plastics actually turns into endometriosis-like things in your body. So when you think about like, why do I feel so sick or whatever, like just be very conscious of that. Like plastics is not our friend. Don't microwave your food in plastics. Try to get away from plastic cups as much as possible. Just be very cognizant of it. Like we can't avoid it, but just know, like when you just know, you'll start to be a little bit more aware of it. to the thing that I am currently focused on right now, and again, going back to April's point, is this is a lifestyle. It is not something that you can fix overnight. My current journey, I'm realizing what stress does with endo and your cortisol levels, your hormonal levels, it all affects what happens to your body, right? So paying attention to your stress is key. I'm gonna hit on the working out bit because it's not the working out part that we need to do, it's the sweat part that we need to do. Like when you sweat, you're getting rid of those extra hormones in your body that cause us to have that excessive endometriosis or hormonal imbalances. Get in the sauna if you can, at least once a week. Walk if you can. Get in the sunshine, get some vitamin D. You will see a difference. And three, with your water, yes, we need to drink water, but plain water is not going to help us. You got to have electrolyte water. You need to make sure that you have your magnesium because magnesium is the only thing that's going to help with making sure that those pains don't increase fast and regularly. So if you are dealing with a lot of extreme pain, get on a magnesium citrate, glycinate. Put that in your water. Put some sea salt in your water. Put a little baking soda in your water. That will help the water actually absorb in your system a little bit more. And vitamins. I can't preach about your vitamins. Like, get your blood work done. See where you are as far as deficiencies go. And actually focus on that because half of it is like your body is stressed because it's trying to overfunction with your deficiencies. So for me, I'm vitamin D deficient. I have to get my shot once a month. If I don't get my vitamin D shot, I can tell the difference. If you get your blood work done and it shows that you are vitamin D deficient, you can go get a vitamin D shot. You don't have to deal with the over counter and all of those things. IV hydration works wonders. Once you know what your blood work is and you know what your body is deficient in, you can just go and get your IV hydration if you need it. But yeah, I mean, again, this is not one fits all. So if you think that just a pain pill is going to help you, it's not. You will end up taking those horse pills, you will end up taking hormonal therapy, and then you're going to be wondering what's going on with my liver down the line. So you have to figure out like how do I lower my stress? How do I get the excess hormones out of my body? How do I help my environmental factors without changing so much all the time, but just pay attention to it. And burdock root was my love. Like I don't know what it is about burdock root, but if you take a burdock root and some beet juice right before your cycle, it helps out tremendously. So those are my tips.
Amazing. Thank you for that, April and Kyla. Oh, Brittany, go for it.
Um, those are like so many good tips. That was good. Um, I was yes, I have been asked to get a hysterectomy. I walked out of there. I was in Texas. I walked out of there crying. I told the doctor I wanted to have kids, and um, then he suggested hysterectomy. So it was a very confusing time for me because I'm like, and also like I feel like some doctors like don't also understand like medical racism, how like I was taught at a very young age of like medical racism, how like what they were doing to us when we were in like in the 60s and testing women and how they even how OB-GYN got started, it was testing on Black women. So it was very much like, dang, are they trying to do this again? Like this is crazy. And I did say I wanted to have kids. So definitely didn't do that. Um Birth control, like April and Kyla said, like in my opinion, I know some women like love it. I thought it was just a band-aid thing. It never really like, and I thought it caused more of the ups and downs. So I was already up and down. So I thought it caused more of it. Um, but there are a lot of other things I've tried. Like obviously, like we've talked, I have a sauna, like I use my sauna very like excessively. Acupuncture, red light, vitamins. I think the biggest thing like for me has been like lately, even like post-op, like and my pain has like changed a lot. Just like investigating, like Kyla said, like I want to know everything. I want to do full allergy tests. What foods I'm allergic to? What environmental factors am I allergic to? What's the history of my mom and this? Like my mom, tell me what happened when I was younger with my medical history. Like I want to know like knowledge is power, and knowledge about myself is more powerful than anything else. Like I can go to the doctor's office and tell them more about myself than you could even tell, they could tell me about them or me. So it's just been like super powerful to like really start investigating, like doing, I want, and being comfortable saying like, I want the blood work. I ask for the blood work. Yeah, ask for the blood work. Like you may not feel like it's not necessary, but ask for it. Like I do, because a lot of times people like doctors will not want to run certain blood work. I'm just like, no, I want the blood work. I have insurance. I'm thankful and grateful that I have insurance. So if I have, and I didn't grow up with insurance, so. I have insurance now. So you're gonna run that insurance and you're gonna take everything I come in here for, run the test. So, because like the biggest thing that knowledge is power. Knowledge is super, super power. And yeah, like someone just said, you can ask the doctor to document in the chart if they refuse, like, and doctors will get a little nervous about that. But like, that's true. Like you can ask and and also like what I also found has been really helpful is like going to the next doctor. This doctor made me feel a little iffy. On to the next. This pelvic therapist, I didn't like what they said. On to the next. I'm quick. Like I just on to the next. I have to go where I feel comfortable. Because also Kyla talked about the stress. Like I don't want to go. That's gonna trigger my symptoms more if I have to go in there and I feel stressed around my provider. Like that's not gonna help me ease the pain or ease the symptoms that it's causing. So just being really good investigator on yourself has really like helped a lot.
And if I can piggyback off of that, Brittany, one more thing. If you treat yourself like an athlete, it will change the game. Even for myself, like I have a primary, but sometimes I don't know if you guys are in Maryland, but I use Life Med, and that's what most NFL players and, football players use. They go to these health clinics. My clinic is very specific on they do all of my blood work. It doesn't feel like I'm in a clinical setting, right? Like it feels like a spa setting. I get all of my vitamins there. I get all of my shots there. I get, all of my red light therapy there. I get my IV hydration there, right? So you don't necessarily need to go to a doctor. You can find a wellness center that will, give you that white glove service if you need that. And some of that can be, especially the blood work. My blood work is still covered on my insurance and things of that nature. And things that aren't covered on my insurance, I use my HSA card. So again, like you don't necessarily have to use the regular routes of the health system if you choose not to.
Awesome. Thank you for those helpful tips. And you're getting a lot of great feedback in the chat. So thank you for those. I think the last question we have, and we're a bit over time, but I do want to just offer it to Brittany. I wasn't sure if this was a question that you wanted to answer live or by typing, but Ina asked, as an athlete using your physical body for most of your work, how do you navigate the challenges of showing up for something you've committed to, although your pain may be debilitating?
I'm laughing because it's very hard. And that's why I think like in sharing like my body is my job. So it's like I get paid to run fast. I get paid to win medals and win trophies and win crowns and all that stuff where it comes with it. So um how do I navigate it? Pre-surgery, I think women in itself are really good at compartmentalizing and putting things in their place and just here, it's here, this is the pain, I have a flare, at this race, okay, on to the next, on to the next. But then I got to a point where it's just like, the flares are happening when I'm not on my period. The flares are happening, I'm stressed and they're happening. The nausea, the headache, the low iron, I'm having to get multiple iron infusions throughout the year, like, because I was a heavy bleeder. So, like, I would just be, when you work out, you also burn iron. And then if you are a heavy bleeder, you're also burning iron. So I'm like losing so much iron. I'm like constantly having to get iron infusions. So, um, it got to a point where it's like I just can't keep putting it in its compartment. Like I think as women and as an athlete, I'm really good at just being tunnel vision. But it's also like this is my body, and I don't want to walk around in pain all the time. If I can do something to help it, I will. And that's when I got the surgery. And life has changed in this surgery in a lot of good ways, but it's definitely still managing like my triggers and my flares and my symptoms, environmental stuff. Like it's definitely still managing, but um I would say even more so now, it's been like a more of like a mental like game that I'm playing because like post surgery, like obviously like a lot has changed in a positive way, but it's also been like mentally like hard of like accepting that like I wouldn't even say hard, but more so like um trying to find ease. I think that has been like a really big game changer for me, like how I grew up, how I started my pro career, and then dealing with endo. Like it's been so hard. It's been so rugged. It's been so rigid and it's been hard. And since the surgery, a lot of positives, like the pain has like really like been like not diminished, but it's like really tolerable at this point. It's not as extreme as like a 10. But it's like I also have to create ease in my life. Like I'm trying to win. I'm trying to win at a place that's ease. It doesn't have to be so hard. And I think that has been like a mental, like I'm having to accept the fact that like and be okay with the fact that I do want ease in my life. Like I think all of us want ease. Like we don't want to have to be in pain. We don't have to fight and try to, get the answers and do like the, I want that ease. I want to cultivate that ease in my life. Um, so that has been like really like interesting, like really trying to like be mindful of that. Be mindful of my like since post-op, like stress has been a big trigger for me. So I'm just being mindful, like what are my stress points? What out I have really bad allergies. Like what are things I'm allergic what are outside stuff that I'm allergic to? How can I got an air purifier? Like what other stuff that I can do to like have my body not always be in fight or flight, not always be activated. Like how can I also like bring it down? Because I got the surgery, it's helped a lot, but like there are still some other triggers in my life. So yeah, it's been definitely hard navigating it. And then plenty of times where it's been like, oh, I don't even know how I'm doing this. But yeah, I think it's been a lot of mental fortitude and mental like pushing through, but also like also not pushing through, also being okay with just saying like, no, I'm not gonna do that. No, I'm not gonna like, especially since post-op, my body has been very clear on me and telling me what is going to trigger me. So I've been very like, I'm not gonna put my body in that position to be triggered again. I'm just not. I've come a long way to get the surgery and to like mitigate a lot of pains. I'm not gonna do that again. So finding ease, really trying to find and cultivate ease in my life and still running fast, but like I think and obviously with running, like the best runners are the most fluid, the most calm, the best runners are, you're not fighting, you're just, it's a ease, it's a grace to it. So, and I can apply that grace also to my healing journey and my keeping my body sane. So, yeah, definitely learning how to adjust and have ease and cultivate ease in my life.
Amazing. Thank you for ending us on that note of finding grace and ease in life. I think that's applicable across all people and all conditions, but especially for a condition like endo, that really is, such an impactful part of a person's life. So I think that wrapped us up beautifully. Thank you, everyone who stayed a little bit later. I know that we are a little bit past time, but the conversation was flowing so well and folks were really engaged, so I wanted to get to as many questions as we could. So with that, we will end our evening and say thank you so much for everyone for coming out. Again, I hope for the panelists, you've been looking in the chat. It's been nothing but a flow of joy and gratitude for your time, which we absolutely echo. So thank you and good night, everyone.
Thanks, Noelle.